Guidance on shielding and protecting people who are clinically extremely vulnerable from COVID-19. Updated the 17th of May, 2021. Who this guidance is for. This guidance is for everyone in England who's been identified as clinically extremely vulnerable from COVID-19. This includes those people who have been identified by the NHS as being clinically extremely vulnerable, and those identified through the COVID-19 Population Risk Assessment. All of those identified have been added to the shielded patient list, and more information on the criteria used is given here. If you have been identified as being clinically extremely vulnerable, you will previously have received a letter from the NHS or from your GP telling you this. You may also have been advised to shield in the past. This guidance applies to clinically extremely vulnerable individuals only. Others living in a household with someone who is clinically extremely vulnerable are not advised to follow this guidance. They should instead follow the advice and restrictions that are in place for everyone in England. Find out more at https://www.gov.uk/guidance/COVID-19-restrictions-what-you-can-and-cannot-do. There is different guidance for clinically extremely vulnerable living in Scotland, living in Wales, and living in Northern Ireland. What has changed? Shielding is currently paused. Although the advice to shield has ended, clinically extremely vulnerable people must continue to follow the rules that are in place for everyone. We're also advising clinically extremely vulnerable people to continue to take extra precautions to protect themselves. You're advised to follow the practical steps given here to minimize your risk of exposure to the virus. Guidance on meeting family and friends has been updated, with a greater emphasis on personal responsibility. From the 17th of May, close contact with friends and family will be a personal choice, but you're encouraged to exercise caution. You should consider the guidance on risks associated with COVID-19 and actions you can take to help keep you and your loved ones safe. There's more information available on meeting friends and family. Vaccination. Everyone on the shielded patient list should already have been offered a COVID-19 vaccine. If you've not yet received your first dose, please contact your GP or book your vaccination appointment online. To do so, visit https://www.nhs.uk/conditions/coronavirus-covid-19/book-coronavirus-vaccination/. If you have received your first dose, you should still ensure you take up your second dose of the vaccine when it's offered to you. Having 2 doses should further increase your level of protection. For children aged 12 to 15, vaccination may be appropriate for those with severe neurodisabilities. This option should be discussed between parents or guardians and the child's clinician or GP. For other children aged 15 and under, whilst further research is being done, vaccination is not yet recommended. No vaccine is 100% effective, and therefore even if you have had both doses, there's still no absolute guarantee that you won't become ill from COVID-19. As such, you should continue to take the extra precautions set out in this guidance to help protect yourself. Socializing inside and outside the home. Guidance on meeting friends and family has been updated for everyone. From the 17th of May 2021, if you're meeting friends and family as a group of 6 people or 2 households indoors, or as a group of up to 30 people outdoors, you can make a personal choice on whether to socially distance within your own group. However, social distancing requirements continue to apply in the workplace and in businesses and public venues. There's more information available on meeting friends and family. Visit https://www.gov.uk/guidance/meeting-friends-family-COVID-19. As someone identified as being clinically extremely vulnerable, it's important that you continue to be cautious when meeting others. You should think about the risk of catching or passing on COVID-19, both to yourself and to others, before meeting people you don't live with. You can take steps to make meeting family and friends safer, such as meeting outside if possible, as the particles containing the virus that causes COVID-19 are quickly blown away, which makes it less likely that they'll be breathed in by another person. By making sure the space is well ventilated if you meet inside, open windows and doors, or take other action to let in plenty of fresh air. For more information, please see the guidance on COVID-19 ventilation of indoor spaces. By considering whether you and those you're meeting have been vaccinated, you might want to wait until 21 days after your second dose of a COVID-19 vaccine before being in close contact with others. By working from home where possible, and by washing your hands regularly and avoid touching your face. You're encouraged to go outside for exercise, and you can do so with people from outside your household, subject to the wider rules on social contact. You can find tips and advice on staying active and eating healthily at NHS Better Health. Visit https://www.nhs.uk/better-health/. Try to reduce the amount of time you spend in settings where you're unable to maintain social distancing with people outside of your group, or where other people's activities may reduce their likelihood of maintaining social distancing. You can continue to form or maintain existing support bubbles if you're eligible. And you can find more information online about how to stop the spread of coronavirus. Visit https://how-to-stop-the-covid-19. Work. Everyone is currently advised to work from home where possible. If you can't work from home, we're no longer advising that you don't attend the workplace. Your employer is required to take steps to reduce the risk of exposure to COVID-19 in the workplace and should be able to explain to you the measures they've put in place to keep you safe at work. Some employers may introduce regular testing of employees as part of these measures. You may also want to consider how you get to and from work, including if it's possible to avoid using public transport during rush hour. Separate government guidance has been issued on how employers can make workplaces COVID-safe, including how they can maintain social distancing and a system of risk management in the workplace. The Health and Safety Executive has also published guidance on protecting vulnerable workers, including advice for employers and employees on how to talk about reducing risks in the workplace. If you need support to work at home or in the workplace, you can apply for Access to Work. To do so, visit https://www.gov.uk/access-to-work. Access to Work may provide support for the disability-related extra costs of working that are beyond standard reasonable adjustments an employer must provide. If you have access to occupational health and employee assistance programs in the workplace, these services can also provide you with a range of health support and advice for your physical and mental health needs. The Coronavirus Job Retention Scheme, or furlough, has been extended until the 30th of September. You may continue to be eligible throughout this period, even when shielding is paused, providing your employer agrees. The Self-Employment Income Support Scheme has also been extended until the 30th of September. From the 1st of April, you're no longer eligible for statutory sick pay, SSP, or employment and support allowance, ESA, on the basis of being advised to shield, given the lifting of shielding measures nationally. You may be eligible for SSP or ESA if you're sick or incapable of work, either due to coronavirus or other health reasons, subject to meeting the eligibility conditions. If you have concerns about your health and safety at work, raise them with your workplace union, the HSE, or your local authority. Where employers are not managing the risk of COVID-19, the HSE and local authorities will take action, which can range from the provision of specific advice, issuing enforcement notices, stopping certain work practices until they're made safe, and where businesses fail to comply with enforcement notices, it could lead to prosecution. The existing employment rights framework provides protections against discrimination, unfair dismissal, and detriment. Specific guidance has been published for employers and workers on work absences due to coronavirus. The Citizens Advice Bureau also has information about your rights at work and how to solve problems in the workplace. If you have concerns, you can also get advice on your specific situation and your employment rights by visiting the ACAS website or calling the ACAS helpline on 0300 123 1100. School, college and other educational settings. It's important that children attend school for their education, well-being, mental health and long-term development. Clinically extremely vulnerable pupils and students should have returned to their school or educational setting. This includes early years provision, wraparound childcare, and applicable out-of-school settings. Children who live in a household with someone who is clinically extremely vulnerable are not advised to shield and should have returned to school or college on the 8th of March. Where parents are concerned about their child's attendance, they should speak to the child's school about their concerns and discuss the protective measures that have been put in place to reduce any risk. They should also discuss other measures that can be put in place to ensure their children can regularly attend school. The use of rapid lateral flow tests allows us to identify individuals with coronavirus who don't have symptoms. This makes up around a third of all cases. Finding these asymptomatic cases, along with other infection prevention and control measures such as social distancing, can help us to manage the spread of the virus. To safeguard the health of the teaching workforce and keep as many staff, pupils and students in school and college as possible, we've made rapid lateral flow tests available to schools and colleges. Lateral flow tests can also be accessed directly for households, childcare and support bubbles of primary and secondary school pupils, and for households, childcare and support bubbles of primary and secondary school staff. This testing will also help keep safe those in the community who are clinically extremely vulnerable and their families. All secondary schools and colleges are continuing to put in place a range of protective measures to help minimise the risk of spreading COVID-19. These include social distancing, hand washing, use of face coverings in specific situations, bubbles, enhanced cleaning, ventilation, and managing confirmed cases. All education settings have implemented a range of protective measures recommended by Public Health England, which, when followed, create an inherently safer environment for early years children, pupils, students, staff, and families. Travel. If you need to use public transport, you must wear a face covering unless you're exempt. Consider travelling outside peak hours to reduce the number of people with whom you come into contact. If you do travel, walk or cycle if you can. For longer journeys, or if you are unable to walk or cycle, try to minimise the number of people you come into close contact with. You may want to avoid car sharing with people from outside your household or support bubble, and ensure that you use a face covering when using a taxi. Going to shops and pharmacies. While you're not advised to avoid going to the shops, you may wish to continue using online delivery for food and essentials, or to ask family and friends for help. If you do go out to the shops or the pharmacy, consider going at quieter times of the day. You must wear a face covering in all shops unless you're exempt. If you've already registered for priority access to supermarket delivery slots using the Shielding Support website or through your local council by the 31st of March, we can confirm that the participating supermarkets will continue to offer priority access until the 21st of June. After then, individuals can continue to book deliveries from a supermarket. You might still want to ask friends, family or volunteers to collect medicines for you. The NHS Volunteer Responders Programme is still available to help those who need it. Volunteers can collect and deliver shopping, medication and other essential supplies. To self-refer, call 0808 1963 646, lines open from 8 a.m. to 8 p.m. 7 days a week, or visit NHS Volunteer Responders for further information. Go to https://www.nhsvolunteerresponders.org.uk. There may also be other voluntary or community services in your local area that you can access for support. If you require additional care and support, it's important that you continue to receive the care and support you need to help you stay safe and well. Providers of social care and medical services are making every effort to ensure services remain open and as safe as possible. You should continue to seek support from the NHS for your existing health conditions. You can access a range of NHS services from home, including ordering repeat prescriptions or contacting your health professional through an online consultation. To find out more, download the NHS app or visit NHS Health at Home. Go to https://www.nhs.uk/health-at-home. If you have an urgent medical need, call NHS 111, or in a medical emergency, dial 999. It's also important to look after your mental health. Go to the Every Mind Matters website for advice and practical steps that you can take to support your well-being and manage your mental health during the pandemic and beyond. The Let's Talk Loneliness website also has a variety of tips, advice and resources that you may find helpful. If you or someone you care for experiences a mental health crisis, we urge you to make contact with a local health professional immediately. NHS mental health trusts have established around-the-clock telephone lines to support people of all ages to get the help they need when they need it. Any carers or visitors who support you with your everyday needs can continue to visit. They should continue to follow the guidance on how to stop the spread of COVID-19 at all times. Find out more at https://www.gov.uk/how-to-spread-of-the-COVID-19/how-to-stop-the-spread-of-COVID-19. You can also access additional support from your energy supplier. Energy suppliers are required by the regulator Ofgem to hold a register of customers in a vulnerable circumstance, called a Priority Service Register. If you're clinically extremely vulnerable, you can be added to the register. For information about how to be added to the register and the additional services your supplier can provide you, please visit the Ofgem website. Telecoms providers are also required by their regulator, Ofcom, to support vulnerable customers. For information about the additional services your supplier may be able to provide you as a vulnerable customer, please visit the Ofcom website. If you're struggling as a result of coronavirus, please visit www.gov.uk/find-coronavirus-support or contact your local council to find out what support is available. Definition of clinically extremely vulnerable groups. People who are defined as clinically extremely vulnerable are thought to be at a very high risk of serious illness from coronavirus. There are 3 ways you may be identified as clinically extremely vulnerable and therefore included on the shielded patient list. 1. You have one or more of the conditions listed in a moment. 2. Your clinician or GP has added you to the shielded patient list because, based on their clinical judgment, they deem you to be at high risk of serious illness if you catch the virus. Or 3. You've been identified through the COVID-19 Population Risk Assessment as potentially being at high risk of serious illness if you catch the virus. If you don't fall into any of these categories and haven't been contacted to inform you that you are on the shielded patient list, follow the guidance for the rest of the population. If you think there are good clinical reasons why you should be added to the list, discuss your concerns with your GP or hospital clinician. People with the following conditions are automatically deemed clinically extremely vulnerable and therefore included on the shielded patient list. Solid organ transplant recipients. People with specific cancers. People with cancer who are undergoing active chemotherapy. People with lung cancer who are undergoing radical radiotherapy. People with cancers of the blood or bone marrow, such as leukemia, lymphoma or myeloma, who are at any stage of treatment. People having immunotherapy or other continuing antibody treatments for cancer. People having other targeted cancer treatments that can affect the immune system, such as protein kinase inhibitors or PARP inhibitors, and people who have had bone marrow or stem cell transplants in the last 6 months, or who are still taking immunosuppression drugs. People with severe respiratory conditions, including all cystic fibrosis, severe asthma, and severe COPD, that's chronic obstructive pulmonary disease. People with rare diseases that significantly increase the risk of infections, such as SCID, severe combined immunodeficiency, or homozygous sickle cell disease. People on immunosuppression therapies sufficient to significantly increase the risk of infection. Problems with the spleen, for example, splenectomy or having your spleen removed. Adults with Down syndrome. Adults on dialysis or with chronic kidney disease, stage 5. Women who are pregnant with significant heart disease, congenital or acquired, and other people who have also been classed as clinically extremely vulnerable, based on clinical judgment and an assessment of their needs. GPs and hospital clinicians have been provided with guidance to support these decisions. That completes this recording.